Good afternoon.
Good afternoon. My name is Kristen Treat, Kristen Treat. And first off, I'd like to thank you for taking the time to hear from so many of us today. I would like to start by saying that I understand how many of you feel. 5 years ago, I met for the first time a woman who had given birth to her son in her home. To say I was shocked would be putting it mildly. I didn't know people who could do that, nor did I have any understanding why anybody would choose to do so. I thought at best she was ill-informed, and at worst, downright neglectful. That woman later became a friend, and over the years we had many conversations about giving birth at home. She would direct me to research literature, statistics about planned home births, books, and more. One thing she said in our conversations that really stuck with me was that I didn't have to believe that home birth was a good choice for me and my family. I simply needed to respect her choice, her right to make the best choices for her and her family, and she would respect my right to do the same. Over time, I began to realize that with proper prenatal care and screening by a skilled, certified nurse midwife, that home birth wasn't the dangerous undertaking that I had imagined it would be. I also began to understand that simply giving birth in the hospital wasn't a guarantee that you were going home with a live baby either. Just like in all aspects of our life, life is unpredictable. Over the years, I've learned so much about the process of childbirth. Amongst other things, I've become a doula where I work with women in labor, providing physical, mental, and emotional support. When I began doing this, I was very naive to how women in labor are treated in the hospital. Sadly, I can give countless stories of women being stripped of their basic dignities of human beings while they were giving birth, including privacy to urinate and defecate, because nursing staff thought the mom might try to violate some arbitrary hospital policy. It was after these experiences I truly began to understand why many women who had experienced the hospital ride the first time refused to buy a ticket to that ride again. In my professional life, I'm also a provisionally licensed mental health practitioner, working under the supervision of Terry Dishler, licensed mental health practitioner, certified professional counselor. I'm certified in perinatal mood disorders and work with a focus on post-traumatic stress disorder after childbirth. Though I have been working in this field a short time, a trend has already emerged. Women reporting birth trauma often feel violated by hospital staff and experience flashbacks about childbirth at a hospital again. As a result of the law as it is currently written, many of these women are making the choice to give birth unassisted, without any guidance or medical support in the case of a rare emergency. Despite the concerns you might have about the safety of home birth, it stands to be noted that women in this state are having home births. And by refusing to allow a competent caregiver who can guide the process for them, the state is in fact making this process riskier for these women than it needs to be. In their statement regarding planned home birth, the American Congress of Obstetrics Gynecology, their Committee on Obstetric Practices states, although the Committee on Obstetric Practices believes that hospitals and birthing centers are the safest setting for birth, it respects the right of women to make a medically informed decision about delivery. The women of Nebraska ask that you respect this right as well.
Other questions or comments? Thank you for your testimony. Our next proponent